Okay, thank you. And before I introduce our esteemed guest here, I would like to introduce Ms. Josanne Lucas, who is the advisor and coordinator for the Bioscience Career Academy. And Josanne, would you take a minute to introduce yourself and tell us a little bit about your program before we get started?
Sure, absolutely, Ms. Capel. So welcome all, welcome Dr. Unger. I am so excited about hearing your presentation. So the Bioscience Career Academy, right, the BCA at Fort Collins High School is a rigorous program that develops students for job skills, prepares them for employment. And we do have a fairly rigorous program and 3 different pathways: the biotechnology pathway, crime scene investigation pathway, and biomedical pathway. Part of earning the BCA endorsement and the diploma is to complete an internship. And part of the cafe is to have speakers come in to discuss their careers that helps guide students in a particular career path. And you are contributing to that today.
Perfect, thanks.
Okay, thank you, Josanne. So the format today will be to hear from Dr. Unger, and I'll make a quick introduction, and then we will have a question and answer session after we hear from Dr. Unger. And the way we'll approach that is, if you have a question, instead of putting it in the chat, if you would just put your name in the chat, and then we will call on you in order. That would probably be the most efficient, because we do have quite a large number of people on this call today. So Dr. Kevin Unger serves as President and Chief Executive Officer of Poudre Valley Hospital and Medical Center of the Rockies, 2 of 12 hospitals within UCHealth, a nationally recognized healthcare system with operating revenues of $5 billion and a workforce of more than 24,000 people. Dr. Unger also oversees other UCHealth locations in Northern Colorado, including Yampa Valley Medical Center, Greeley Hospital, Longs Peak Hospital, and numerous ambulatory medical centers. So Kevin, would you like to take it away?
You betcha. And I don't have a formal presentation, and I'm very much looking forward to the question and answer, but I'll kick it off and talk a little bit about my career. And I'm sorry, I hope it's somewhat interesting to you, the students, but I am a Fort Collins native. I was actually born at Poudre Valley Hospital, grew up in Fort Collins, and so went to O'Day and Riffenberg elementary schools, Lesher middle school, and then ended up graduating from Fort Collins High School before going to Colorado State University for my undergrad. And so I am really a local hometown guy. I love Northern Colorado, and it's been a real privilege to be able to work within, at the time that I was hired, it was just Poudre Valley Hospital. Now we are UCHealth. And my career progression is I have now been with UCHealth for almost 20 years, which I don't know exactly how that the time keeps ticking off. I am now responsible for the hospitals here in Northern Colorado, which include Longs Peak and Longmont, Colorado, which we opened 2 years ago. A new hospital in Greeley, which we opened just a little over a year ago in July, called the Greeley Hospital. Very original. I know that is a very innovative title and name for that facility. Poudre Valley Hospital. I'm at Medical Center of the Rockies right now, so if there's an overhead page, I apologize, because once in a while we'll deliver a baby and you'll hear Brahms' Lullaby come on over the loudspeaker. They may have a code or something like that. So I hope we don't get a whole lot of interruption. And then I also am responsible for Yampa Valley, which is up in Steamboat Springs, and they are all part of UCHealth, as well as we have management contracts with facilities in Wyoming, the Cheyenne Hospital in Cheyenne, Wyoming, Laramie, which is Ivinson Memorial Hospital, and then the hospital in Sidney, Nebraska. And so we have a pretty good footprint. I live out of my car, and so I'm making the rounds between the different facilities, and my role is a lot of fun. I love what I do because it's very, very diverse. We, of course, I'm responsible for the operations within the facilities, but I also get to interact with the community. I get to do these talks with you all, which I'm just thrilled that we have such good participation this morning. I'm gonna put in big plugs for healthcare here in just a moment, but I'm just enthused that you all are taking an interest in the healthcare industry and are considering it as a potential career for you as we move forward. But my job, I get to interact with patients, with our staff. We have just over 5,000 employees that work for UCHealth here in Northern Colorado. And so right now, during this pandemic, and this is such an interesting time to be giving this talk because things are starting to tick up again. My primary job right now and what's keeping me up at night is how do we keep our staff safe right now and not get sick? Because during the kind of the first wave of the pandemic, our big issue was getting our PPE, so masks and drapes and different things that we had never had a shortage of in my life. I've never talked about masks or PPE in my life until the kind of the first wave of the pandemic hit. This second kind of wave that we're experiencing right now, we're in good shape with PPE and all of the supplies that we need, but we got to keep our staff healthy because if our caregivers start having to stay home and be quarantined, we're not going to be able to take care of our patients. And so that's really job one is trying to focus on that. And then keep the county, the cities, the public officials kind of informed on what's happening within the facilities. And so this morning I was on a call with the county commissioners over in Weld County. I was on a call last night with Larimer County and their public health department talking about what our COVID numbers look like and our overall capacity within the different facilities. And it is my job is fun because you jump around and you get to do a lot of different things at different times, and I really do enjoy that. But the healthcare industry itself, I have a son who is working on he would like to be part of our EMS team, and so he's working at Front Range on getting his credentials there. I always tell my kids that healthcare is a wonderful place and a wonderful career as you move forward. Everybody, we get to help people in their toughest times and some of their greatest joys. And so it is it's very rewarding. It is a people-focused industry. But what's neat about kind of the different roles is we're running kind of a little mini city, and there's different things that you can do within healthcare. And so people mostly think about doctors and nurses, but there's managed care, there's long-term care, there is the pharmaceutical industry, the biotech. There are so many facets to healthcare that you can't clump it into one specific thing. We also have marketing, we have human resources, but we also get to run labs, and we get to run expensive equipment in our imaging departments, and we have operating rooms and surgeons and nurses up on the floors and transporters. And so there is something for everybody, I believe, in my world, and that's, I think, what is neat. Also, if you're looking at industries that I do believe are going to continue to grow and are going to continue to be hiring, we are in a hiring frenzy right now. And so there's a multitude of positions that we can just not hire quick enough to fill our needs. Right now, it's critical care nurses there's a national shortage. We're all vying for the same pool of people right now. Lab techs are in huge demand as we're doing more testing as it relates to COVID and the flu. We're also running 2 clinical trials within UCHealth as we speak, working on the COVID-19 vaccine. We're part of the Moderna trial, as well as what's been coined the Oxford trial through AstraZeneca here in Northern Colorado. And so there's a research component, which is always an exciting piece as well. We're always hiring X-ray, med techs as it relates to MRI techs, CT techs, always in high demand and hard to recruit into those positions. And our salaries and benefits are very competitive throughout the United States as well. And so I also really enjoy healthcare for the fact that you can really go anywhere you would like and have a career in the healthcare profession. So rural communities traditionally have a hospital or clinics. Of course, metro locations have all sorts of different healthcare opportunities, but you can pretty much live anywhere you want and still be part of the healthcare industry. You just look at the hospitals that I get to interact with. We've got Sidney, Nebraska, which is the home or was the home of Cabela's in Nebraska, and it's a 25-bed hospital. Yampa Valley up in Steamboat's 37 beds, and I think if you've ever had a desire to live in Steamboat, working at that facility would be a terrific job opportunity, and it could play into maybe some of your lifestyle needs and desires as well. And then, of course, we have facilities all up and down the Front Range in Colorado, but we are just one of a multitude of systems throughout the United States. And I think it just provides you an opportunity to live in different locations, still have a wonderful career. And so we are, as I said, in a hiring frenzy. If you look at our job board, we have over 3,000 jobs posted as we speak, and we're looking to actively hire. And I know, and I do feel for many different industries that are really suffering right now. Kind of contrary to popular belief, COVID is not a good thing for us either. And so we're taking care of a lot of COVID-19 patients, but because of that, we have to start scaling back on our elective procedures, which is really how we pay our bills. And so we're working hard, but it is not exactly what we traditionally do to keep the lights on and pay our staff. And so we've got different challenges, just like everybody else does with the COVID-19 virus. We're doing more testing than we've ever done in the history of the health system. If you've driven by our testing sites, you're seeing long lines of people wanting to be tested for COVID-19, and we're hiring like crazy people to help us do those tests. And so, you know, as students, you may want to look at some of these different opportunities that exist in today's environment, just to get your foot in the door and kind of get a taste and a feel for what it's all about. But with that, I have been babbling. I do have personally, I graduated from Colorado State University with a degree in sociology of all things. I then did go on a program called Semester at Sea, which CSU now sponsors, which was a wonderful opportunity for me to get on a ship and travel around the world and experience different cultures and different lands and different people and religions. And it was a very enlightening opportunity that I was blessed to be able to take advantage of. I then kind of muddled around. I worked for a real estate development company, and I rented out apartments and commercial space for a while. I worked for Oppenheimer Mutual Funds down in Denver for a while as a customer service rep, basically answering the phones and answering whatever questions that I could. I ran a limousine service for a while with 1933 Packard Town cars. And it was more stressful than the job I have now. we were running old cars around Denver to weddings and this and that, and it was interesting. And then I finally found my way to healthcare, and I was looking at my skill set, decided that I had some skills that I think could be applicable to the healthcare industry. Went back, got my Master of Science in Health Administration and my MBA from the University of Colorado at Denver, so just down the road. And then ultimately, I did get my PhD at Colorado State University, and so that's my doctor. I am not a medical doctor, but I do have my PhD from CSU. And as I said, I was hired at Poudre Valley Hospital as the director, vice president of marketing and strategic development, and then moved into an operations role. I was their chief operating officer at Poudre Valley. We built Medical Center of the Rockies, this facility here. And then I ultimately became the president of Poudre Valley Medical Center of the Rockies. And then we affiliated with University Hospital down in Denver and created UCHealth 7 years ago. And so now we've been growing as a system, and we have multitude of different facilities up and down the Front Range. We're able to take care of about 90% of the state's population, which is terrific. And we continue to grow and expand. And so I will leave it at that, and I would love to answer whatever questions you all have for me. And nothing's off limits. So
thank you, Dr. Unger. Anthony Davidson, are you on the line so that you can call on students who have requested to present a question?
I am. Our first question is going to come from Corbin Macy.
Hi, I was listening to the early part of that, and I was wondering, as a state of before COVID, you guys, I'm kind of curious how you guys are running before COVID, then during COVID, and then what do you think that it's going to look like after COVID, after we know what masks can do? Do you think that your staff will be wearing masks even when there's not a prevalent disease in the air? But I'm just curious, what did it look like? What's it looking like? And what could it look like in the future?
Sounds good, Corbin. That's a great question. And so we've been kind of pre-COVID, we were just like the rest of society, probably a little bit more stringent on our infection prevention policies. And so we've got environmental specialists that are continually making sure that everything is sterilized and clean, but we have definitely taken that up to a whole different level since COVID kicked in. We are masking everywhere, even when you get out of your car and walk into the facility, we're requiring masks. I don't see that going away anytime soon. It's going to take a vaccine to really start settling that down. Promising though that Pfizer, their information that came out this week that their vaccine is 90% effective. That's unbelievable because usually with the flu shots, if you can get up around that 50 to 60% effective range, that's usually pretty good for the flu. So 90% would be a home run. And I think that would be the only thing that would probably reverse some of the masking trends that we're seeing. The big things that we know will help prevent spread is masking, social distancing, so the 6 feet away, washing your hands, making sure that we're continually keeping our hands clean, and then avoiding social gatherings. And so just staying out of large groups. And those are the real things that we're really working on right now, trying to keep our staff healthy. We've got plexiglass that's gone up everywhere. All of our waiting rooms are spaced so nobody is close, but we've got so in our operating rooms we've got teams that that we put together that do, you know, a knee replacement, or they will do a cardiovascular procedure, or they are specialists in doing general surgical procedures, or this and that. In between cases, it is a very, it's a closed unit. And so it's a very sterile field. There's lines on the floor that you can't cross without having basically scrubbed in, put on your surgical gowns, your scrubs, and we make sure that we keep those areas clean. But in between cases, we have waiting rooms that everybody goes and congregates, and we're working really hard at trying to make that area socially distanced, which as humans, we love interactions. The ORs, they're all great friends. There's great camaraderie because they all have to rely on each other. And trying to keep them apart during the breaks is not an easy thing for us. And so, you know, but long story short, I think we're going to be wearing masks for quite some time. I've been working on a project with Colorado State University. So we've got some relationships in Japan, CSU does, and I've been a representative of UCHealth with CSU to try to bring some of these different projects together. And we've been going there for 4 years, maybe 5 years, and masking is commonplace in Tokyo and the suburbs and most everywhere that we go in Japan. People have been wearing masks since we started there. We thought it was a bit unusual, but it just became their culture and the way they do things. And I suspect we will probably continue to follow suit. What we do experience, though, is when we've got people that are wearing masks, you know, 8-9 hours a day, pressure ulcers, skin breakdowns, acne seems to be kind of an issue that we're dealing with. And so we're trying to find ways to continue to mask that don't have such adverse effects for our staff. And so one issue leads to another issue, and we're just always continuing to try to figure out how to make it work. If you come into our facilities, you'll see people are now wearing kind of a beanie that has buttons on it. So instead of having to put that mask around your ears, which is a sensitive area, people can connect it to the beanie, and then it doesn't have quite the effect, at least on your ears. But we're all struggling with it. I'm sure you all are struggling with it in school, having to wear a mask continually, and it's a nuisance and annoying. And you know, people I've worked with for a while, I bump into them and I don't necessarily always recognize them with the mask on. And I'm also realizing I'm a lip reader, that, you know, without being able to see somebody's mouth, I'm always saying, can you repeat that for me, and this and that. But I do think it's making a difference, and I appreciate all you guys wearing masks, because I think that that's really gonna be one of the key pieces that's going to keep us all safe and healthy as we move forward. Corbin, I was rambling, but I appreciate the question.
Thank you for answering it.
Our next question will come from Sarah Keller.
Hi. So mine fits pretty close to that, and I may have missed it, but I know that because of COVID, you're not taking student or volunteers right now. And so I'm a radiologist intern this year, and I was wondering if you have any idea of when students can come in, or volunteers, or anything like that.
Man, that is a great question. I just got a call yesterday from one of our long-term volunteers who's so missing not being in our facilities. And I was hopeful about 3 weeks ago that we were gonna be able to start kind of opening things up a little bit, but as of this week, we're actually backpedaling, and so we're reducing our visitation again in the hospital. So we were allowing 2 visitors per patient per day, and we're backing that into only 1 visitor a day. And I would anticipate maybe by the end of next week we'll be at no visitors again. But we're going to have to really kind of get through the second surge, Sarah, before we're able to start kind of considering bringing students back. That's part of our mission, is to have students within the walls of the facilities, and so it hurts to not be able to do that. We just it's not the best environment yet, and so I would guess, you know, we'll reassess after the first of the year, and hopefully things will start kind of calming down. I do believe the vaccine is going to be key to bringing students and volunteers back into the hospitals. But truly, our goal is to get you back in here, and we've got some neat programs around the radiology department where we take students. And I don't know if you're part of that program, but my niece was several years ago, and it's incredible. And being in radiology, you get to see all areas of the hospital. That's what's so cool about it, is you're on the OB unit doing ultrasounds. You know, you're in the trauma rooms, you're going up on the floors, and it is a glimpse into all aspects of clinical care within the facilities. And so good for you, and we'll try to get you in the walls of the hospitals just as soon as we can, Sarah.
Thank you. I'm enjoying it. So hopefully.
I'm glad. And who are you working with? Is it within UCHealth?
Yes, I'm part of the, I think it's a district-wide program. So
awesome. Well, good. And at the end, I'll also give you all my my email address. And if there's areas or things that I can do to assist, please let me know as well. We're doing just everything's virtual. I was just talking last night, our county public health director, his name is Tom Gonzalez, and I'm on a call with him twice a day. Never met him in person. It's the weirdest thing. I feel like I've known him for years, but everything has been Zoom and virtual. And I think, Sarah, maybe we can somehow incorporate some virtual components into it, but it's not the same. We want you to have the hands-on experience, and we'll move to make that happen as soon as we possibly can.
thank you.
Thanks.
Okay, our next question is going to come from Lucy Glenn.
Hi. So as president in the beginning of COVID, what kinds of difficult decisions did you have to make, and like how did you make them?
Yeah, this is, you know, I never thought I'd actually lead through a pandemic. So this is, we're learning a lot, and unfortunately, we were changing things daily, and so we kind of had a lot of communication overload happening with our staff. They were all very flexible with us, but right out of the chutes, the PPE piece was huge, and PPE stands for personal protective equipment, and it is N95 masks. It's the gowns, and it's all the different supplies that we use to keep people safe. And the rules and regulations almost hourly, and we were changing almost hourly. So that was a big deal. We went into incident command mode, and we're currently back in incident command mode, and that was somewhat new for us as well. We had done it kind of more on a test basis in the past. We went into incident command mode. We had Ebola outbreak scare, but it hasn't happened much in my career. We've been in incident command mode pretty much steady through this pandemic, where we're trying to figure out where we have bed capacity, where we have personnel, where we have supplies, and we're getting the patient to wherever that location is. And so that's been a big thing that we've been working through. We have daily incident command calls where we go through and talk about what our challenges are, what our shortcomings are, if there's any patient safety issues, how do we tackle that? But the communication piece has been key. Just how do we communicate effectively so that people just don't say, I've had enough, I can't take one more email, I can't take one more Zoom call. And so that's been big. But we've learned a lot. We are competitors with Banner Health. We've been collaborators with Banner Health throughout the pandemic. I think that's been fun to watch. All the hospitals in the state have been working through this. And then, it's not just COVID, it was the fires. We were there to support the firefighters through our EMS teams. We tested, I think, 70 firefighters over a weekend when they were having some COVID scares, and many of them tested positive, but our community was also having a lot of respiratory issues just because the air quality was so bad. And so, just trying to manage our bed capacity has been challenging. We are always busy this time of year, regardless of whether you have COVID or fires or anything else. We're all out and about hurting ourselves. Trauma kicks up, flu kicks up. And so this is just a challenging time for us to also throw COVID on top of that. But I've learned an immense amount. It's exhausting. I've been, like, at the end of the days, I'm sitting there having dinner or watching television and catching up, and I sometimes just doze off. I was on a call with the governor and fell asleep. And that's terrible. I shouldn't even be admitting that, but it's just, it's just there's just so much going on that we're trying to balance and keep up with it all at this point. But I don't know if I did a very good job of answering your question, Lucy, but it is a good one.
Thank you.
Thank you.
Okay, Bergen, you are up next.
Okay, I was just wondering what kind of internships you guys have. I know there probably are like a ton of them, but could you kind of go into what you guys, like, what certain internships you have for what you want to go into, I guess?
You betcha, Bergen, and that's a really good question. So we've got internships all the way from like hospitality services, which is our nutrition department, all the way up to accelerated nursing programs, where if you're interested in becoming a nurse, we'll pay for it, and then you'll owe us a couple of years of service. And so that's an interesting one. We have the radiology internships that we're supporting all the way up to medical students at this point. And so we just put a new program in place between Colorado State University and University of Colorado, where we're going to have a cohort of medical students at CSU. This is collaboration that, believe it or not, has never happened between CSU and CU. And so it's really, it's quite gratifying to be able to be part of it. But basically, there's going to be a cohort of medical students that train at CSU. And also, they do their clinicals within Poudre Valley Medical Center of the Rockies and a number of our rural sites. But CU was extremely excited about this relationship because of the high clinical quality of the vet program and the different sciences at CSU. And so that's been a lot of fun. And so we have family practice residencies that we support, but you name it, we're willing to look at internships. We have administrative internships so we take an intern or two every single year that they spend more time on the administrative side with me and our team. But clinically, we've got programs in the pharmacy areas, in the lab, in the imaging side, radiology, as Sarah's participating in. And so we will accommodate nearly anything within the facilities that students are interested in. Did that help, Bergen?
Yes, I'm so sorry. Thank you so much.
You don't need to be sorry.
Sorry, I was muted. Nora, you are up next.
If that doesn't happen 10 times a day, then I'm not feeling like I'm in the right place. So.
Okay, this is a little bit controversial maybe, but what are your thoughts on socialized healthcare? Like, how would it affect the industry and kind of society as a whole?
Yeah, that's not really a controversial topic. You know, many industrialized societies have socialized medicine, meaning that they provide medical care for their entire populations, and it works different in different countries. And so there's a great book by a gentleman named J.R. Reed. He writes for the New York Times. It's called Healing of America, where he had a shoulder issue, and he traveled around the world to see how it would be treated in different countries. And kind of his punchline was that there are countries that are doing a much better job than the United States on the family practice side, the primary care front. And so they provide better access to internal medicine physicians, pediatricians, to family practice doctors, OBGYNs, than a lot of our patients in the United States have access to. And so that was one of his conclusions. He also kind of concluded that here in the United States, we're quicker to jump to a surgical cure, where other countries would try physical therapy, or they would try other mechanisms before jumping to surgery, which is so common here. But he also found a lot of different barriers to care in these other countries. And so while it is available to everyone, for instance, up in Canada, it could take him up to 3 months to 6 months to even have an MRI or a CT to diagnose his shoulder injury, because there was such a lack of resources that were put in those different areas, that many of the Canadians that could afford to do it would come across the border to the United States and have either the procedure, the images done quickly, because there was such a delay. And so kind of what he found is there's no perfect system out there, and that healthcare is expensive. Here in the United States, fundamentally, and this is not UCHealth, this is Kevin Unger's personal opinion, we as a country have to decide whether healthcare is a right or if it's a privilege. And if it's a right, we've got to adjust the system to make sure that we are taking care of everybody. There is access points, but the system's broken. And so if you cannot get in to see a family practice doctor, our emergency rooms become your primary care location, and that is the most expensive, least efficient, least coordinated way to get your health care. And so it is an episode of care. It's episodic, meaning we'll come in, you come into our emergency department with a sore throat, and we'll treat your sore throat. But we're not looking at your diabetes. We're not looking at your heart care conditions. which a primary care physician could better coordinate and make sure that all of those different pieces were taking place. It is really kind of the healthcare of last resort. And we treat a lot of patients that can't afford to go to a private physician's office. But they're not getting the best care either. Our EDs provide outstanding care, but that is not, they're not a primary care office. And so, you know, I'm really mixed. We fundamentally have to make some hard decisions as to whether it's a right or a privilege, and then you can build a system around that. But we kind of straddle the fence. We kind of say, yeah, it is a right, but it's not, and it's just, it's a challenge. What I would like to see, and this is totally my opinion as well, is for there to be like a Federal Reserve for healthcare that is kind of quasi-governmental, but does not report directly to the politicians. Because if I'm a politician, I have a hard time making the hard decisions, because I also got to get reelected at the next phase of my career. And so saying that I'm going to cut this or I'm going to do this is potentially political suicide. So we need an entity that doesn't have those political pressures to really start sorting out how we want our system to look like. Now, with that said, we have one of the best systems in the world for tertiary care. We've got kings and queens from other countries and sheiks and anybody that can come into the United States to have their heart procedure, for their advanced care procedures, because we get incentivized to do that care. And that's kind of how we as healthcare make our living, is by doing those kinds of procedures. And so the rest of the world that can afford to come here for that, because we do that exceptionally well. But we could definitely do the primary care better here in the United States, and maybe a socialized program would achieve that. It's just getting from A to B is very challenging. I kind of sound like a politician. I kind of answered your question, but do know that most of that is just Kevin Unger's opinion on life. So
Yeah, sure. Thank you.
You bet. Thank you.
Okay, next up is Reese Hunter.
So I was wondering, like, going into like month 8 of like coronavirus shutdown, I was wondering, like, this is kind of a dark question, how much has it, like, would severe outbreaks affect hospitals' outbreak rate, and then that affect, because I feel like it's a rabbit hole, right? The more outbreaks there are, the more outbreaks that happen in hospitals, the less workers there are, so they can't take care of people. The more outbreaks there are outside of really your control. So like, what's your thought process on that, of like how to stop it and all that kind of stuff?
Yeah, Reese, well, one, definitely vaccine's going to be beneficial, but it is a self-perpetuating problem. And so where we're seeing most of the breakouts right now are within homes. And so with students back in school, with universities back, people are working out, they're out and about within the community. Is where we're seeing the biggest spread right now, is within families, and then gatherings within the house. So I invite Ms. Capel over for dinner, and then one of my kids test positive, and then suddenly there's 8 new cases of COVID in the city. And so really avoiding the gatherings, which is hard You are in the prime age group that I feel for you all, because this is we're all social beings and we all want to be together, but you may be one of the more dangerous cohorts, because you may get sick and you may not feel great for a day or two, but you're not going to end up in my hospital. The odds are against that you would require hospitalization, but it could be your parents or your grandparents that you inadvertently infect that will end up in these facilities and need a higher level of care. And so, it is a balancing act, and I am continually on calls with city officials. They're looking for direction, and I am kind of in the business of providing the facts of what's happening right now. We have, as we speak, 30 COVID positive patients here at Medical Center of the Rockies. 10 of those patients are in our intensive care units, and so they're requiring ventilators and a higher level of care. At Poudre Valley Hospital, we have 20 patients, 8 of which are in the intensive care unit. And then in Greeley, we have 14, and 5 are in the ICUs right now. And so I was on a call with the county last night that open mic and public comment, and a lot of people were saying this doesn't exist. We're killing businesses. We're doing all sorts of different things. I am here to tell you that COVID is absolutely real. And if you walk the halls and if you're in our ICUs, people are extremely sick, and many will not make it through it. And so, just trying to, I'm worried about Thanksgiving. My parents live in Fort Collins, love to get together with them and celebrate Thanksgiving, but we're going to bypass that this year and do Zoom, just because I don't want to infect them, because they most likely would have a much more negative response than myself or my kids would have to COVID as well. And so I think the only way we're going to kind of dampen it down is once again social distancing and washing our hands and masking and making sure that we're being very diligent there. My biggest risk factor is I have a 13-year-old daughter. I also have 19-year-old. And they're having a hard time staying away from their friends, and I get it. But because of that, I'm trying to also kind of distance a bit from them, just because that's how this stuff gets spread around.
Thank you for that. And I'm chock full of questions. I'm sorry, but
no, go keep going.
So going back to the beginning of what you were talking about, vaccines, I heard were going to be a big factor.
Mm-hmm.
I remember hearing somewhere in February, like before the outbreak came to the U.S., or right at the beginning of the outbreak in the U.S., they were saying that it's going to be approximately 8 months until we get a vaccine. But now, as soon as March hit, there's all of these different sayings of like, okay, it's being postponed from anywhere from 3 months,
right,
to we have another to like 2023. So what are your thoughts on like when a vaccine will be released?
Yeah, I'm getting more optimistic. This Pfizer vaccine, we're supposed to, as healthcare providers, get our first shipment of that in about 6 weeks, which is remarkable. The challenge with that vaccine is it has to be stored at -80 to -90 degrees, and we don't have fridges or freezers that actually keep things that cold. And so they are actually building the freezers that they're going to ship the vaccine in to us. And then there's going to be some logistical challenges as well, Reese, because the Pfizer vaccine is 2 shots. And so after you get your initial vaccination, 28 days later, exactly 28 days later, we have to re-vaccinate. the individuals. So there's going to be some logistics involved in that, but we're part of that AstraZeneca Oxford trial. All of the researchers and scientists that are working on that think it could be a home run, and the Moderna trial could be as well. So in theory, we could have multiple vaccines that within the next 6 to 9 months, which is much more promising than I would have expected, because it traditionally takes years and years and years to bring these vaccines to market. And so we'll just have to kind of wait and see if it all does come to reality. None of the science behind Pfizer's study has been released, even though they're a big company. They've been through this before. So if they say it's 95 or 90% effective, I gotta believe that at this point. But I'm more optimistic than I've been around us bringing the vaccine to market. And we're a capitalist country, and so I mean, there's billions of this market is global. This is everybody wants this product, and so I believe in American and capitalists will figure out how to make it happen sooner than later. So I hope I'm not being over optimistic, but everything that I'm hearing sounds good at this point.
Thank you.
You bet, Reese.
Okay, Peyton, you are up next.
So I'm interested in being a biomedical scientist, or like something to do with developing vaccines or medicine. What job opportunities or internship opportunities are there at the hospital, or like where else could I work in the field?
You bet. Well, we have an entire research department that works on different clinical trials that we have within, just here within Northern Colorado. We traditionally have about 150 to 200 clinical trials up and running, mostly in cardiovascular within our oncology department. University Hospital down in Denver, who's our partner, this is basically all they do. So they've got 1,000 clinical trials that are open, and they're looking for researchers, and they've got labs everywhere. Colorado State University and their vet program is also a great way to get your foot in the door. There are labs all over CSU that are doing research as we speak in different areas on humans and with animals, and in all sorts of different ways. So CSU can be a huge resource for you as well. But I would look at those different locations right out of the chutes as being good opportunities to expand kind of your research scope and thoughts and ideas. And Dr. Luckison, his name is Gary Luckison. He is a cardiologist here. He's the one that's running our AstraZeneca trial, and he'd be a good person to be in contact with. He's our director of basically research for Northern Colorado here.
Cool, thank you.
You bet, Peyton.
Jenny, you are up next.
So could you elaborate about the scientific aspect of the COVID vaccine trials? Like, what does the selection and testing process look like? Because I'm curious about how those are being conducted and would like to hear some more details about it.
You bet. And each of the different trials has different criteria. So down in Denver with the Moderna trial, we were enrolling 150 individuals a week into that trial for let's think 7 weeks, and that was heavily skewed towards looking at minority patients of Hispanic descent, African American descent, because that population has been hit particularly hard by COVID-19, and so that study was focused more on some of our minority populations. This AstraZeneca trial here in Northern Colorado, basically they're looking for a wide variety of different patients. And so I've talked to Dr. Luckison. He said they're enrolling those that are diabetics, have heart conditions, older population. It is much more varied than the Moderna trial is. But basically, each of these different companies have different requirements and different areas that they're looking at, and they're launching trial sites throughout the United States that are looking at different patient populations. So it just depends, really, because there's individuals that thought they would never get into a clinical trial that actually they are prime candidates for these different sites and different trials. So I'm vague, but I think it just depends, Jenny, what they're looking for in different areas.
Right. Thank you.
You bet.
Caleb, what is your question?
Maybe on mute, Caleb.
Okay, so we'll go on to Thayer.
And then after Thayer is finished, I do have a couple minutes scheduled for a closing from the leadership team, and then we've got to let Kevin get back to what he does.
Sounds good.
Thayer, are you there? All right. Jacob? Okay, Thayer, go ahead. Can you put your question in the chat, please? Thayer would like to know what your favorite part of your job is.
Working with people. I very much enjoy the people aspect, but also working with people can be quite frustrating. we sometimes have some incredible things that happen with walls of the hospital that you couldn't even make it up, kind of something. So I love working with people, and sometimes I don't enjoy it as much as I probably should as well. But I'd say that the people and the diversity in my job is what I really enjoy. I have a short attention span, and so this gives me the opportunity to dabble in a lot of different areas and be part of a lot of different things. And so I very much enjoy that. But our people are outstanding. And some of them misbehave from time to time. So.
That's a great question and answer on which to close. So Kevin, I want to thank you so much for your time and your generosity. I know you've got so many things happening right now, and this was super special and meaningful to this group of students who have a specific interest in working probably for UCHealth in our near future. I would like to introduce Chandler Ray, who is a member of the leadership team for the BCA, and she and her teammates have something that she would like to say to you.
Perfect.
Hello, I'm Chandler. Thank you so much for taking time out of your Friday to come talk to us. It was really nice. It was, especially since it's something new. Like, we've never had anybody in a position that you are in come and talk to us about your job and your process and how you got to where you were and are. It was great. It really did give us a better understanding of how much more there is to the medical world and everything. We really couldn't be happier to have someone like you come and present and share what you could. It was great. We loved it.
Thanks.
And we hope that we can have you come again after all of this COVID stuff.
You betcha. And if you need doctors or scientists, you'd like to talk to the crew, let me know. I put my email address in the chat room there, and just let me know. You can go ahead and ping me, and I can at least point you in the right direction as to people who'd be good to have at your next cafe as well. So.
Wow. Well, thank you so much. Thank you. I hope everybody has a safe weekend. And take good care of yourselves. And we will talk to you soon. And Kevin, thanks again. Absolutely amazing.
Thanks for having me. I appreciate it. You guys have a good one. Stay healthy and take good care. And if I can support you in your career, let me know.
Thanks,
Thank you.
Kevin.
You bet.
Thank you. Bye.
Thank you. Have a good day.
Thank you.
Thank you. Thank you so much.
Thank you.
Thank you.
Thank you.
So sweet.
Thank you. Have a good day.
Alex Ballou, are you still on?
Kelly, I don't think Alex is on anymore.
Okay, Pam, you can probably answer. So I tested, and I know the students are still on, which is fine. I tested the recording earlier this morning because I'm on a loaner computer. So before I log out, is there any way to erase that test timeline?
From the beginning?
So the students don't have to look at all of that.
I think there's a way, but I haven't done it. So I will need to check with our tech people. Josanne,
Yes.
have you done it before?
I have not. Don't quite use Microsoft Teams.
That's no problem. I'll get Channel 10 to come in. I'm just not going to log out for a while, so I'll just mute myself and you guys can carry on.
Once you stop the recording, it should automatically download, and then you should be able to send that download to Channel 10. And then they should be able to edit it, hopefully.
Well, I think everybody on the meeting, it's automatically available to them. So there's going to be 25 minutes that the kids are, just not needing to see. So I'm going to mute, and then Pam, I'll give you a call in just a second.
Okay.
So, what are we doing, guys?
I gotta say, I'm so proud. Such amazing questions, wonderful presentation. It was just too short.
No, it's pretty long. It would have been a lot better though if we were able to actually do this in person.
I mean, we got the information.
Yeah.
Lots of
but
good
it was
questions.
nice. I was very entertained. Like it was just I just love the fact that it was something so different.
I think too, though, Chandler, that people like Dr. Unger, we may not be able to get in person. Being able to do it in this format is more efficient for his time. So I think that's one of the reasons we've had as many people who've responded to the speaker series, because it's a little more convenient for the guest speakers.
Also, we never have this many questions in person.
Yeah, exactly. Yeah, that's
so many questions being asked. Like usually in person we have like 5 questions.
Barely even, but no, it was nice. It was really fun because you can tell he was super excited. And I mean, it was just these questions, they weren't like, what's your dog's name, type questions. They were like actually like legit questions. And I was like, I would have never thought of some of the things that some of these people have asked.
It was good. I'm not even a science person, and I'm like, oh, this is really cool.
Oh yeah, and even to say reach out anytime with any questions. And I really hope all of you take advantage of that. Take him up on the offer. Any guest speaker, actually. They all want to help.
When do we have the forensic guest speaker coming in?
Next week, so the 20th.
I'm so excited. So excited. Oh.
I know, that's right up your alley.
Could not be happier.
Right up your alley.
Are we ever gonna get like a doctor, like an actual like doctor?
I am a doctor.
Station?
I can do a meeting. I know doctor things. I watch doctor shows.
I watch Grey's Anatomy. I can do it.
Like I watch The Good Doctor and New Amsterdam. I and House and Scrubs. Tell me what kind of doctor you need me to be, and I will be that doctor.
Honestly, yeah, I've seen all 17 seasons of Grey's Anatomy. I can just do it. Like I can do all the talking.
Yeah, exactly. Like we can do it. We can do it. Let's compare it. Let's do a presentation, and then let's actually have like a legit doctor come in, and let's see how close we can get. I think that'd be cool. That'd be great.
Yeah, one thing to think about is while we have a lot of guest speakers lined up, we only have a limited amount of scheduled meetings because it's usually 3 per semester, if you think about it. So to have more speakers would mean to have more cafes.
And I'm fine with that, though. I am.
Yeah. So we'll fit it in, especially if we have this current format where we're at home on Fridays. It's ideal.
It's a lot easier. It really is.
Yeah, and we don't have to be in the building at night.
Well, did you just see the message that came out to PSD families?
We just got remote learning like 100%.
Yep.
Okay, aren't we supposed to be doing an interview, though? I'm kind of confused. Were we supposed to be doing that? Is that a thing? Right?
I believe so. So it was the lady who spoke at the very beginning who said she's from, but I don't think she's on anymore.
It was Alex Blue, right?
Yes.
Yeah.
I think that's what Kelly was checking on because she had asked if Alex was still on. But I'm not. I didn't know about the interview until this morning, so I'm not.
Because I got all dolled up for it.
Me too. I'm wearing that for going.
Yeah, like this is a nice classic sweatshirt.
Well, I mean, this is still being recorded. They could still pull some of this. They could still pull some of this footage.
I want that doctor part, how she can play a doctor. That's what I think should be in the footage.
Like, do I need to reenact something? Give me a scene.
I really into it. How hard can it be?
My cousin's actually an ER doc. He just graduated from med school and is now working as a ER doc.
I could be an ER doctor. I got it. I see. Oh, what's that room? No, what's that? It's like emergency ER. What's that show called? What happens in the ER? Or
Untold Stories of the ER.
Untold Stories of the ER. I could do that. I could. You know what? I'm gonna make a play. We're doing it. The BCA is doing a play. We will be the first.
I actually really want to.
Internship? Can I do that? Can I just do a play?
No.
Oh, yes. I think so. I think so.
That does not count. Nice try.
I think it should, though. All I'm saying is we're giving them some good content in this video. So, guys, how's your day going? No one's...
They just sent in the call out saying we're going completely remote starting the 23rd.
Yep.
Yay! Guys, I like school. I don't want to be away from school. I learn in school. I don't learn at home.
I know we have that for a lot, but with the current rates and what's
Yeah,
happened at
it
Fossil,
needs to happen. Yeah.
unfortunately. I kind of thought they would do just the high schools, but
Yeah. We'll see. We'll see. We'll see. I just hopefully we'll be able to come back in the spring though. I feel like that would be nice.
Honestly, at this point, I'd be happy we have a really nice graduation ceremony.
Yeah.
At this point, that really is all I'm asking for.
True. True.
yeah. We were able to do it last year.
Yeah.
I just feel by then by spring, I feel like things will be a little bit better. Hopefully though.
Hopefully.
But we will have to see what happens.
And Chandler, while we're waiting, can you give both Miss Davidson and myself add us as collaborators to the T-shirt design, that form?
Yes, I can send it to you guys. I can put it in the what's this
Well,
called? The
no,
message.
not send
Oh.
the form. So if you go to settings, there's an area that says add collaborators.
Oh, okay.
So yeah, so we could see responses and see who replied, all that stuff. I did send a reminder out, so hopefully
yes,
we got a bunch of responses.
I'm like almost a lot of people did respond to it, which I was impressed. We got a total of so far like 35 so far. Which I was impressed with that because I didn't think we did that many so soon.
I think the reminder helps because most people tend to use that instead of anything else. Which one's in the lead?
So far, it is option number 3, and I don't remember which one that was.
Okay, yeah, it's a gray one with BCA, and then it has It's Magic That Works Science on the back.
Yes. And so where can I share it with you guys? Just it's like an add collaborators.
Yeah, let me see if I
Pull it up on
find
the screen and then we can see it and we can walk you through it.
Oh yeah, that's a good idea.
Okay. Or I can. Oh, I think I can. Yeah, I think I figured it out. It's just taking a hot minute to load. Settings. Oh. Okay. How do I do this? How do I add show my screen? Show it here. Can you guys see my screen?
No.
Hold on. I can do it. I got this. I'm a pro. I'm a professional. Oh, this is trippy. This one? Oh, can you guys see now?
Yes.
Okay, so I'm at settings, right?
Well, actually go to, what is it? The 3 dots, the skinny snowman. Yeah.
3 dots.
And then add collaborators.
Okay, I got it. Awesome. Okay, I'll add you guys right now. And Yes. Okay, it's sending to you guys.
Yep, it works. I could see responses now.
Awesome, cool.
Interesting comments.
I know, right? I kind of laughed at some of these. Like some of these, they're like, no, lol, no, thank
Yeah,
you.
but
It's
you
like,
know, some good ideas.
I was so nice in mine. I didn't know we could be rude in them. I was
well,
like, that's
I
so
said be
cute, but not my
thoughtful.
favorite.
Exactly. I was just like, okay. But these also were designs. Like the first one was, I don't remember. I think Leah made that one. Someone made the first one, but then like the last couple ones, I kind of just threw together last minute, not gonna lie. Just for funsies.
It's good to have options.
Yeah, and so then I wanted to make sure I left like, you know, them to be able to be like, can we, you know, change this color? Can we change, you know, this? Which I was impressed that actually a lot of people said, yeah, let's change to this. And I was like, okay, that's fine, that's okay.
When you want the final decision to be.
Yeah. All I'm saying is I would like a